it brings also a different perspective of looking at complex evaluation of children in need. I think put together with a long-term evaluation of these aspects might bring us to a much better knowledge base of what children needs and how we can provide it in the most effective way. Having said that, I would like to introduce our next speaker, Dr. Bob Gworg from Chapin Hall at University of Chicago. I'll do that in Hebrew, and then when I say the name of your presentation in English, that means that you can come over here. דוקטור גוארג הוא חוקר בכיר במרכז צ'פין הול באוניברסיטת שיקאגו. יש לו ניסיון של מעל 25 שנים במחקר. העבודה שלו מתמקדת בעיקר בבניית מסדי נתונים ומידע על ילדים ומשפחות, בעיקר אלה שזקוקים לשירותים מיוחדים ושקשורים להתעללות ולהזנחה. במסגרת העבודה שלו בצ'פין הול, אני מניחה שרובכם מכירים את מרכז המחקר הזה, הוא פיתח את מסד הנתונים על תוכניות לילד ולמשפחה באילינוי. המסד הזה מציג נתונים על מקבלי שירות, חינוך, מערכת השפיטה והענישה של בני נוער, אבטלה, שירותי בריאות ותוכניות לגיל הרך, ומספק תמונה כוללת על השימוש של הילד והמשפחה בשירותים ובתוכניות ציבוריות. דוקטור גוארג קיבל את הדוקטורט שלו מבית הספר למנהל ציבורי באוניברסיטת שיקאגו, וגם הוא נמנה על המייסדים של האגודה הבינלאומית לאינדיקטורים של הילד. So I would like to invite Dr. Gworg to present us with the first step of, I need my glasses for this. The first step in providing services to at-risk children, identifying who and where they are and who needs services.
Thank you very much. I also assume that was a good introduction. Thank you. So Chapin Hall, for those of you who aren't familiar with it, is a policy research center. So my perspective is from the policy perspective, less so from a practitioner point of view. I think the issues are more in a policy realm, and when you look at the differences across Israel, Norway, the United States, it's more around policy and how we view the role of government in social policy and addressing the needs of children. So I'm going to talk a little bit about protective services in the United States, child protective services, how we target families at risk of maltreatment. I'll touch a little bit on evidence-based practice, again, though, from the policy perspective. And then I'll talk about a large study we did a couple of years ago on families in multiple systems, which really speaks to how much violence there is in families, in some families, some low-income families. And the issue of violence in the home, not just abuse and neglect, but other violence, and then some future directions for the work. So in the United States, and this is a quote from a colleague of mine, two colleagues of mine, we have strong views about both the privacy of the family and the right of parents to raise their children as they see fit, as well as value judgments about whether families deserve to receive public support, and that continues to shape the structure and content of the intervention policy. That's why we haven't signed the Convention on the Rights of the Child. This is the reason, because we still believe that children are property of their parents, and they have the rights to, and they don't have any individual rights themselves, and it operates through the parents. And that pervades our entire social policy. So we stay out of government in the United States, stays out of family life until someone is at risk of harming themselves or harming someone else. I don't know, the joke a few years ago for George Bush Sr. was, he was like a fisherman, that when he found a child at risk, a young child at risk, they were too small, so they threw him back until they got bigger, and then they would catch the fish and put it in jail, basically. So prevention is not a high priority for liberals, and obviously even less so for conservative. The best prevention, the idea of prevention in the United States is get a good job, get a good education, make enough money, take care of your children. Send them to ballet, send them to French lessons, send them to additional tutoring, so they can get into Harvard School of Business, Chicago Booth School of Business, and educate and take care of their own children. So therefore, the most dollars in the social service sector don't go to prevention, but go to institutionalization of children, incarceration, and foster care. And that's what I'll show in a study in a few minutes. So in protective services in the United States is an example of this. So we have mandated reporters. I think it's similar here. If you're a social worker, a teacher, a medical professional, you have to report when you believe that a child has been abused or neglected. But there's no outreach. It's all passive, right? There's no outreach to find where the at-risk children are, who are at highest risk. There's no targeting of services. If you're reported and you're investigated and you're substantiated, you might receive services. The child might go into foster care, but we don't go out there and look for families who have problems. So we're very unsure whether we want to help families or punish them by removing their child from their custody. So that's why we separate the two roles of investigation of child abuse and neglect, and then the service provision and the child abuse, service provision if the child goes into foster care or receives services. And I don't think it makes a difference to the families at all. Their social workers are still, the people who control to them what happens to their child once they enter the protective services system. So our mandated reporters, as I said, the police actually are the most likely to report when they go into a home, they see an unclean home or unclean children. That's most likely, it's called neglect. They call the Department of Children and Family Services, and this accounts for about 2/3 of the children who go into foster care. Teachers and medical professionals don't want to be held accountable for children being placed in foster care. And we have very few medical professionals who even report when children have head trauma. And there's a big push among pediatricians to get them to really report head trauma. The parent says, "Oh, the child fell," and they don't go any further than that. Forensic pediatricians can tell whether or not a child's been hit or whether or not it's an accident or not. So they're very reluctant and often poorly trained to identify child abuse. So it's a relatively weak system, the mandated reporter system. In evidence-based programs, we talk a lot these days about the nurse-family partnership that David Olds is so famous for. But it's very much, a program based on selecting a small group of families that come to your attention and providing services, and sometimes evaluating these services, not always. But what we need is, what I'm trying to push is the need for population-based programs. I think what is more likely to happen in Scandinavian countries, where there's more coverage of all families, and there's equal coverage for all families, be they at risk or not. However, one thing about the evidence-based program religion is that we have to measure what we're doing, whether or not a program is working or not, whether or not it's evidence-based or not. There's so many evidence-based programs. So the Obama administration has been excellent at requiring evaluation of programs that the federal government funds. They've been excellent at requiring that there's evidence for evidence for the programs that are implemented, but it's a very low bar at this point because, again, as mentioned earlier, we haven't shown that a lot of things work very well. So it's, we are implementing a teen pregnancy prevention program in the Chicago Public Schools, 5,000 children. And there's one study that shows this is, that has a small study that shows this program has worked. And it's not really that clear to us that it's the best study, but it's one of the few that has shown to work for preventing teen pregnancy. So that's what we're using and that's what we're measuring. And we will likely show that it does not work. That's my prediction. Single parent families, mothers who had their first child as an adolescent, in the United States, that accounts for 2/3 of all the children in the child welfare system, those mothers. So if a mother has a child as an adolescent, there's a huge risk, and they have these other characteristics. Families without grandparents living with them, so grandparents are very obviously protective. Even though they might have not done well with their first child, they often do well with their grandchildren. Alcohol, drug use, and mental illness, inadequate parenting skills, family breakdown, parental stress, a lot of what is in the literature. Community level socioeconomic status, poor communities. I'll show later in Chicago, we're very segregated. The poor live in just just a part of the city. Family size and sibling spacing. So how closely families have children. These families that show up in the child welfare system often these mothers have a child every year. Targeting. Again, we know where the vast majority of these families live. We know it from census data. We know it from administrative data. We know that historically a high proportion of children in these neighborhoods, 20 to 30%, will come to the attention of child protective systems at some point in their lives. We know exactly where those places are. State government knows exactly where those places are. And roughly 1 out of every 4 or 5 families who receive services from the state has abused or neglected one of their children. So that's extremely high proportion of children in these communities where we know that this occurs. So what we did, this was a larger study. The governor's office, for those of you who know the United States, that governor entered prison a couple days ago. But he was good in a lot of ways. He was very good for children. And he wanted to do well for children. He implemented preschool for all in Illinois. We can no longer pay for it because he spent too much money. But he had a very great interest in vulnerable families. And what we did, and so the belief was that a relatively small proportion of families was using up most of the resources of state government. And again, most of these resources being incarceration, foster care, institutionalization. So what we looked at the major problems: mental health services, substance abuse treatment, adult incarceration, juvenile incarceration, and foster care, and just to see at how many of families in Illinois, in our state, showed up in these systems. So a family, defining the family was the hardest part of this study. What is a family? And then measuring what a family was is the second hardest part. So these households are in general very complicated. You have multiple generations living in households. You have sometimes single parents, sometimes 2 parents. We're doing a national study right now in which we have this group of families that have 3 parents in them. So it's sometimes confusing. But what we did was we looked at families who were receiving food assistance or welfare services, and all those families that were in the child welfare system. And we combined all of those families, and I'll talk about how many that is in a second. Then the problems I already mentioned: mental health services, substance abuse treatment, adult incarceration, juvenile incarceration, and foster care placement. And then I'll also talk about abuse and neglect reporting and unintentional injuries. And then our multi-problem families are those who have two or more of these in their family. It could be two or more of these problems. It could be multiple individuals, but it was two or more of those five in those families. So we found that 23% of our sample were multi-problem families. We saw our sample included over 500,000 households. In Illinois, there are about 1.5 million households. So we had about 500 with children. So we had about 1/3 of all households who were receiving some kind of welfare services or child welfare services from the state. And 23% of these were multi-problem families. 63% of them these 23%, this 1/4, so it's about 100,000 families accounted for 63% of all these problems that we identified, of those five problems. What surprised us the most was that these families were getting mental health services. And not just kind of one visit here, one visit there, but I'll show you also inpatient care. And they rarely had substance abuse problems by themselves or adult incarceration by themselves. If there were substance abuse problems, there was always some other problem. And if they had an adult who was in prison, there was always some other problem, usually some other problem. So this is the graph of that. So we found that 23%, the first column bar, 23% had two or more problems. 34%, so 1/3, had one of these problems, and about a little bit over 40% had none of them. They accounted for 63% of the total problems, 23%. And these 63% accounted for almost 90% of the dollars being served for these 500,000 families. And these dollars included all services, not just the services I mentioned, included all health care services provided to them through the state. It didn't include education, but education is relatively small cost to the state. But healthcare services and all other child welfare services. So really 20% of the families served by the state used up over 80% of the dollars. So it's Pareto's law, if you're familiar with it, the 20-80 rule, held up pretty nicely here. So this is how we did this. We combined administrative data. It's not as easy to do this as it is in Norway. We don't have an ID card, so we had to get these different administrative data systems from the information systems, and we put them together. And we've been doing this for a long time in Illinois. And it's very difficult. We have to talk to lots of lawyers very often, and we need permission for every analysis we do, and spend a lot of time putting this data together. And 20 years ago, I spent a number of weeks here in Israel, and every few years I get a call from somebody here. Can we do what you're doing? Yeah, you can do it, but I think it's the same as in there's a lot of it's not technical. The issue is not technical. Going back to I think an earlier question, the issue is really has to do with privacy, concern for privacy, the concern for the control of the data by these agencies. The substance abuse agency doesn't want to share their data with the child welfare agency. The Census Bureau doesn't want to share their data with anybody. It's that kind of, those types of, and then we have the city data, we have state data, we have federal data, and none of those levels can cooperate. So it's getting better, and as we have more budget problems and they realize we need more information to understand who gets the small amount of services we have left, people want more information. So once it comes down to the dollar, they want more information about who not to serve, unfortunately. So we combine these data sets, and the data set we combined, we captured in our families, in our 500,000 families, we captured all of the foster care half of all the mental health service provided in the state, half of all the substance abuse service in the United States, in our state, Illinois, and about half of all the juvenile incarceration. So in these families, we found a great portion of all these services. Now, the problem in the United States is that we don't know where the fathers are. So we didn't capture adult incarceration very well. So we didn't link everybody that we actually could link. So the numbers could actually be much worse than they are. So we could actually have found that there was more multiple problem families than we found, but ultimately we found that there were enough, unfortunately. So mental health was, again, the biggest service used. Foster care was second. Substance abuse and adult incarceration were third and fourth. And we don't put very many juveniles in prison in Illinois, so that wasn't a very big problem. So families with multiple problems received 94% of them. So these 100,000 that had 2 or more problems, 94% of them received mental health services, which was a huge surprise to us. But families with one problem, about 77% received multiple services. Many multiple problem families received both mental health services and substance abuse treatment, so there's a lot of overlap between that. There's very little difference between those groups, especially among low-income families. Usually the substance abuse and mental health, the co-dependence there is great. We thought mental health services, they'd get one service, they'd go see a therapist, or the family would go see a therapist once or twice, and they'd never see him again. Turns out half of the service is inpatient care, which accounts for part of the cost of this. Half of all those who are receiving mental health services actually experience time in an institution. And a little less than half who receive substance abuse treatment spend time in an institution. So that accounts for a lot of the cost that goes, a lot of the dollars that go to these families. So really, on this last column here, you see the families with multiple problems. 42% of them had adults incarcerated. 60% of them had substance abuse treatment involved. 53% of them had foster care. Again, almost all of them had mental health care. A very few of them, again, had juvenile incarceration because we just don't do that with. It's one good thing about Illinois is that we just don't put kids in prison. This was the most depressing part, and I have to thank Asher for helping me with some of this. So we looked at both those kids who were reported for abuse and neglect. And of our multi-problem families, 3/4, 3 out of every 4, had a substantiated report of abuse or neglect. And then we looked at those at hospital records. 49% of them had intentional injuries that were found in the emergency rooms of hospitals. So a total of about 81% of these multi-problem families had violence in their homes. As I'm sure all of you have heard, we have a tremendous youth violence program, a problem in the United States. Sandy Hook was just the most recent one, we are dealing with that. In Chicago, we have many youth shooting each other, what we're doing is throwing a lot more police officers at it. I can say this here in Israel, because I can say this in Israel, but many believe that that's not the solution, is that these children are out on the street being parts of gangs, in part because they're safer on the street than they are in their homes. This doesn't even count domestic violence, right? This doesn't count domestic violence. So if you added domestic violence into here, how many percent of these multi-problem families would we have? When we do incarcerate juveniles, more often than not, they are abused and neglected children. So what we want to look at further is that I'm going to skip ahead. So this is the state of Illinois. It's because of the PowerPoint, it's fatter than it actually is, but it's really much more narrow than this. And this looks at, this is where Shikaago is, right up here in Cook County. And this is a statewide perspective, so it's relatively, and these are of all children. So of all children, of all households in Cook County, about only between 2.9 and 4.6% of households are multi-problem families. In these very poor southern dark blue areas, we have a higher percentage of families, households being multi-problem family households. The lighter blue ones are all the more urban areas, so we have higher areas. Cook County is a very heterogeneous place. It contains the poorest parts of Chicago and the richest, Illinois and the richest parts of Illinois, so it kind of washes out. So we have to really look at Chicago community areas. This is, again, also a little fatter, but in Chicago, this is south side of the city, and the west side of the city is where we see most of the poverty in these places. And we see that in the dark blue areas, between a third and 40% of families are multi-problem families. So the highest we have is 40% of families in these dark blue areas who live in multi-problem families. But when you look at smaller areas, so this previous one was, these are the traditional, there's 77 Chicago communities. Chicago School of Sociology 100 years ago decided this is how they wanted to break up Chicago. And it still works pretty well, but they're still very large areas. So Chicago has about 3 million individuals. So some of these communities, Austin on the far left side, for example, has 300,000 people living in it already. It has about a large percentage of Chicago. So they're large communities. So we went down to the community level in the census tract. So here you see number of children in multi-problem families as a percent of all children in the census tract. So these dark blue areas, over 60% of the children in these communities live in multi-problem families. And we said 60%, we say 61% plus, because some of these communities have 90% of these kids live in multi-problem families. So combine that with knowing that these families have high violence in the home, we know where they live. So when we go back to the idea of a population-based intervention, Deb Darrow, who many of you may know, a big child prevention scientist, the one thing we do agree on is that in these communities where we have such high violence, high levels of other social problems, high incidence of other social problems, we have to go door to door. You can't kind of just sit there in your office and wait for somebody to call because everybody's trying to avoid you. Neighbors don't call, don't report other neighbors. If these families don't go to their health care provider, if they don't go to pediatricians, the pediatricians won't. And if they can stay under the radar of the police, they just won't be found. A lot of them still are. So I'm less concerned about the 60% who might be in the community than the 40% who aren't, because they're the ones who are literally not being, they're not in the surveillance system. So one thing we do agree on is that you have to go door to door. Every family needs to get the same thing. The service has to become normative. So it's not something different, not something special, that it's in these communities that it's something that everybody expects, and that we can address not just child abuse and neglect, but violence in these homes, and therefore also try to address violence in these communities. So these children feel like they can go home and be protected, So when you talk about evidence-based, whether it's nurse-family partnership or triple P program, functional family therapy, whatever it is, whatever practice you might want to use, it really has to be done on a population basis in these particular communities. So again, that goes into my first area. We really have to identify what interventions work for different types of families. Not all families are the same. There are different types of violences, and there are different types of violence and different types of problems and different types of strengths these families have. So some of these families do have people who have succeeded in school, but other families have never had anybody employed and have never had anybody graduate from high school. When you look at the map, those are also the places where we have the highest dropout rates in the city. We have to understand the problems I studied go back 5 or 10 years for most of these families. So the incarceration may have been 10 years ago. Not that doesn't, if your father was in prison 10 years ago, it still affects you. If your mother had a substance abuse problem 15 years ago, it still affects you. So I'm not so concerned about the recency, but if there are immediate problems, we have to identify them and address those. We have to distinguish among different types of abuse and neglect. Obviously, sexual abuse is different from physical abuse, different from emotional abuse, different from various types of neglect. We have to understand the magnitude of problems. One thing the ACEs, the adverse childhood experiences, have shown us is that there are differences in adult outcomes for as it relates to the magnitude of the problems that children experience. And I've mentioned before, we have to link these to other types of problems. And this is a way to address the crime issue other than gun control. Don't get me started. Gun control and domestic violence in the United States. Thank you.